So here we go. Here's our first type of thermotherapy. That's the therapeutic application of heat. We use this to control pain, to increase soft tissue extensibility and circulation, which then in result will it increase the range of motion and it will decrease joint stiffness. And it also helps accelerate healing. You get the influence of the hemodynamic system, the neuromuscular system, metabolic processes, and altered tissue extensibility. So these are all influenced by that thermal heat. So the hemodynamic effects obviously is that vasodilation where you get that increased rate of blood flow. You also have an increased nerve conduction velocity. Demyelinated nerves get a conduction block. You get a decreased duration of that sodium channel opening of the nodes of Brie and Vere. This will decrease muscle spasm. It will increase your pain threshold, which thus is in result is decrease your pain. This is what we were talking about in our previous lectures. It will decrease your strength for about 30 minutes, gradually recovers and increases over about 2 hours. So the importance of that when you're applying this is to let your patient know that, and if they're going to be using it at home as well, that they then don't want to be doing something that they're going to put demands on that muscle that it can't keep up with and re-injure themselves. The metabolic effects is that enzymatic reactions, increases that rate, increases the cellular biochemical reactions. You get increased oxygen uptake and accelerated tissue healing in that metabolic system. So as far as altered tissue extensibility, it feels there's a greater increase in length after stretch force is applied. The less force is required to increase that length. There's a decreased risk of tissue tearing. This occurs around 104 to 113 degrees of Fahrenheit for about 5 to 10 minutes is the optimal. There is some research out there that talks about being careful about heating a tissue for too long and then stretching and breaking up those collagen fibers. So that'll be something when you pick your project to do your journal presentation, you can dig into that a little bit further for us and report back on the pros and cons of using heat as an effect to get some altered tissue extensibility. Is it a good thing or a bad thing? Contraindications, these are really important. You'll want to know these for the lab practical. You'll also want to look at the rubric because there may be more on there than are on this PowerPoint. So you want to make sure that you list the ones that are in your packet when you're going to go do your lab practical, so you know what things you do not want to use heat on. And basically you want to think about those effects we just talked about. And you don't want to do it to anything where you would, where having an increased blood flow or increased metabolic effect would impair that entity. So a recent or potential hemorrhage, obviously we don't want to have more bleeding. An acute severe inflammatory conditions, again, that increased vasodilation could hinder the healing process. A thrombophlebitis, impaired sensation, we already talked about that. Probably one of the number one reasons people get sued and burned is putting it on an elderly person who might have decreased sensation, or a post-op patient that hasn't gotten their sensation all the way back from the surgery. Impaired mentation, where they can't tell you it's too hot. They could just say that feels great and it could be burning them. Malignant tumor, again, we don't want to be feeding that tumor. Irradiation of the eyes, and pregnancy of the abdomen, the pelvis, and the low back. We don't want to increase blood flow to those areas on a pregnant woman. Precautions would be a demyelinating nerve, and that would be like a carpal tunnel syndrome, multiple sclerosis. Really important with those nerves in the beginning. We really do not want that increased nerve conduction. That's just going to increase inflammation in that area. So really important to understand that and to know the healing phases again, so in the different structures. So with nerves, you're going to treat them a little bit differently than you are a muscle or a ligament or a tendon. Rheumatoid arthritis could be a precaution depending on if they're in their exacerbated state or not. A diabetic, to kind of think about that one, that's primarily going to be most likely because they have some decreased sensations, peripheral neuropathy of that nature. We already talked about the acute injury inflammation. There are going to be times when you can use heat as a precautionary. It just depends on where it's at. You might not be doing it directly to that area, but the area around it. Talked about pregnancy. The precaution would be that you can use it somewhere other than that abdomen or that low back area, that pelvic area. Somebody who doesn't have good circulation, you don't want to be overloading somebody where it just puts more blood flow into an area that they can't pump out. Poor thermal regulation, a systemic infection, edema, cardiac insufficiency, superficial metal implants in the area, an open wound. Topical irritants have recently been applied where you might hinder the effects of that or cause more irritation. Hand motor skills, reaction time needed. So adverse effects. So we talked about this, burns being the number one. Fainting, bleeding, skin and eye damage from the infrared irradiation. Avoiding tissue damage. Use superficial heating agents that can get cooler during application. So that would be like the hot pack, right? It gets cooler instead of hotter. So when somebody's going to use a heating pad at home, you got to be really cautious with them because those get hotter and that can really cause a burn. So you really want to try and have them get ones that are going to cool down. So like if they put rice in a sock and put it in a microwave, that's going to that heat's going to decrease. Same with paraffin. Limit the initial temperature of the agent. Use enough insulation between that heat and that patient's skin, and make sure you provide a call bell for that assistance for that patient, and make sure that they understand, what they're supposed to be feeling, what they're not supposed to be feeling. Do that 5-minute skin check so that you can yourself, especially the first couple of times you put something on someone, so you can understand if they need more layers. So we have the hot packs, the paraffin, ultrasound, fluid therapy, infrared lamps, and whirlpools. We'll be in lab working on hot packs and paraffin this first week, along with maybe contrast baths, which we'll consider. It'll have both heat and cold in it. It'll kind of be our whirlpool, will be the contrast bath. We won't be doing fluid therapy or infrared lamps. Ultrasound will come a little bit later in the course. So here's your moist hot pack. So you have the goal of increasing the temperature of the soft tissue. Obviously, we already talked about this. The larger the pack, the more heat transfer you're going to get. The temperature of a hot pack is somewhere between 158 and 169 degrees. We do have thermometers, so when you are getting the hot packs ready for your lab skill checks, make sure you check the temperature to make sure it's within that range. And if it's not, then we definitely need to just make sure we adjust that, and also in the meantime use extra layers if it's above that. Heating pattern, obviously the heat gets, the temperature declines over time. We go with the number of layers of 6 to 8. The blue fuzzy things that we put them in, we consider that 2 layers. So then you just need 2 more towels folded up, which would be 4 layers. We'll give that 6 layers. If you have somebody where it's extra hot, whoops, sorry about that, then you might use that 8 layers. The time is 20 minutes. So then for your paraffin application, you're going to use that versus heat for those irregular surfaces, such as your hands, your elbow maybe, and your feet. The temperature for this is between 124 and 129 degrees Fahrenheit. Again, there's a thermometer, and you want to check that to make sure that that wax is at the right temperature. You never put wax back into the machine. You want to make sure you keep the wax to the correct level when you're taking care of it. There's different methods. We have the dipping, or you have a brushing. With dipping, we do anywhere from 7 to 10 dips. The duration varies between 15 and 30 minutes. The procedure, you want to wash the area that you're going to do the paraffin on. You want to check for any open sores, make sure they have good sensation, remove any jewelry. That jewelry will heat up. Let me go back again. And then you're going to do your dips. And then you will put it in a plastic bag and then wrap that with a towel to keep it insulated so that that heat will stay in for a little bit longer. Generally speaking, 15 minutes seems to be about the norm. Really, the temperature goes down in about 10 minutes. Documentation. So this is just to know how you would document a modality. You're going to document the treatment area. So it could be right low back, left anterior knee, right anterior shoulder, cervical neck, trying to think what else. Maybe left hip and right sideline. Those would be how your treatment areas. The type of heating agent, is it a moist hot pack? Or it can be either MHP or HP, depending on what facility you're at. Paraffin is just written out. Treatment parameters, how many towels did you use? What was the temperature? What position did you put them in? How long did you do it for? And then most importantly, what was the response to that afterwards? We talked about the pain assessment scale. Did that change their pain any? Were they more, maybe they were having difficulty getting in and off the table or putting their shoes on and off, and maybe after that thermo treatment, they were able to do that with less pain and more effectively. So that's kind of the things you want to document. This is just a little chart comparing cryotherapy and thermotherapy. Our next video will be on cryotherapy, so we can kind of come back to this and re-summarize it. But basically it's talking about that they both decrease pain. They just do it a different way. They decrease muscle spasm. Cryotherapy, the big difference is it decreases your blood flow. It's a vasoconstrictor versus thermotherapy. Hemodynamic effect is that it has its vasodilation, increases the blood flow. Same with that edema formation. Nerve conduction velocity, again, that's an important difference. So cryotherapy is going to decrease that nerve conduction velocity, which you might want in the beginning stages of a nerve repair, and then the thermotherapy increases it. The metabolic rate also decreases with cryotherapy and increases with thermo. Collagen extensibility will decrease with cryotherapy and increase with thermotherapy. Same with that joint stiffness, because you're decreasing that collagen extensibility, you feel increased stiffness in that joint when you're using cryotherapy, but you can get the opposite. When you increase that extensibility, your joint's going to feel less stiff. Spasticity, that have shown that cryotherapy can help with that. It does not, there is no effect with it with thermotherapy one way or the other. And just a common confusion sometimes is people equating a muscle spasm with spasticity, and they are not the same thing. Spasticity is a neurological response. Okay, that's it for now. We'll come back to cryotherapy in a second. Thank you.